Our bodies are really weird. They can do some pretty amazing things, but they can also get hurt really easily. Sometimes these amazing things that they can do is really cool. Sometimes it can hurt you really bad. And that's where the physical therapist comes in. Hi, my name is Lauren Bradford, and one day I want to be a physical therapist. I want to be the person that helps people's bodies whenever they get injured. But before I do this, I have a lot to learn. And that's why I chose this quote for this year in ISM. It says, "Learn everything you can, anytime you can, from anyone you can. There will always come a time when you will be grateful you did." And this quote is really important because physical therapy is one of those things where you have to observe a lot before you get really good at it. And so this quote just really kind of explains how I'm going to have to learn for physical therapy. Before I get even further into this, I'm going to tell you a little bit about myself. I am in band. I am in the Wind Symphony. I play trumpet. I'm also in the jazz band here. I'm also a drum major, which means I wave my hands in front of the band on the marching field. And I also play soccer. I play club and I play for the school. And for college next year, I'm going to be attending Texas Women's University. I'm also going to be playing college soccer there. And the reason I chose Texas Women's is because, one, they wanted to pay for my college, and two, because they have a really good PT program. So why physical therapy? I have an older brother, Aaron, who has always been one of the biggest influences in my life. Aaron played soccer when he was little, so I played soccer when I was little. He was in band, he played trumpet, I was in band. I started out on French horn, but ended up on trumpet. So everything just kind of happened in that way. But my brother is currently studying to become a physical therapist. He's applying to his grad schools right now. And I didn't completely copy him on this because technically I wanted to do it first. But I chose physical therapy mainly because he's such a big influence on me, and I really found that I really enjoyed doing it. And I also chose it just because I have such a strong sports background. I've been playing sports my whole life, that physical therapy is really something that just kind of reached out to me. And also the fact that I've had to attend and I've gotten to see physical therapists working with me, it's just really something that I think I would enjoy doing. For my research this year, I did a lot of my beginning research off of things that had happened to me. Over Labor Day, I was in a soccer tournament and I had injured my knee, and I had gone to the trainer, and the trainer at the tournament had said that she thought I had strained my LCL. And at this point, I had no idea what an LCL even was. I knew it was in my knee because my knee was hurting, but I didn't really know anything about it. So my first research assessment was over LCL injuries. And your LCL is your lateral collateral ligament. It's on the outside of your knee, as you can see by that picture right there. And what it does is it helps stabilize your knee, so when you're cutting and turning and jumping, it really makes sure that your knee doesn't just completely give out. For my next research assessment, I did it over meniscus tears because I went to the doctor, found out it wasn't my LCL, and the doctor said that he thought I might have a meniscus tear, which is just fine and dandy. So I knew what it was, but I didn't know what it meant would happen to me, like would I have to have surgery, what would happen. So I researched meniscus tears, and what your meniscus is, it's in your knee, and what it does is once it wears down, it can't really be restored at a certain point. So it was really kind of terrifying to me whenever he told me that I might have done something to my meniscus, because I could lose my scholarship, couldn't go to college. I was freaking out about everything. But after I had done research over it, I realized that it probably wasn't as serious because I saw some pictures that were pretty nasty of what it looks like once it's gone. And then for my next assessment, I did ACL injuries in female soccer players, because this is one of the most common injuries that happens for female soccer players, and I really wanted to know why it was the way it was and what caused it to be so common. And there's over 30,000 serious knee injuries a year, and of those, women are 2 to 8 times more likely to tear their ACL than men. And a big reason for this is the way that girls' hips are set up. Because our hips are wider, it naturally curves in on our knees, which puts more pressure on our ACLs and makes it easier for us to tear whenever we twist or cut incorrectly. For my next assessment, I did it over the UNT trip. at UNT, we got to go visit any classes we wanted as long as we talked to the professors. They had to be about our topic, and then we could do one that was outside of it. For my class, the big class that I really want to talk about was sports psychology. And this wasn't necessarily completely according to my topic, but I really wanted to know, just because I play sports and I wanted to see what was going to happen. And a big thing that they talked about was communication. And this is also going to be really important when I'm a physical therapist, because I'm going to have to communicate with tons of different types of patients. And so it was really interesting to see the difference between verbal communication and nonverbal, because when you're working with a patient, if you're stretching them out or they're doing an activity and you make a face that makes it look like they're doing it wrong, they're going to get really discouraged. And they're not going to think that they're doing well, which might make them stop doing their exercises, which makes them not get better. And you wouldn't want that to happen just because of something that you accidentally did with your face. For my next assessment, I did more research on ACL injuries, but this time it was more the knee kinematics and bone bruising. And the reason I did this is because this was actually an assessment that I had found before, but I didn't necessarily want to do because I didn't think it was going to be as big of a deal. But after I did my third assessment, I saw that bone bruising had come up in there too. And basically what happened is there's typical bruising on your femur and your tibia because of extension and anterior tibial rotation, which I know that probably doesn't mean anything to y'all, but basically what that means is the twisting and turning that happens on your knee can wear everything down, which causes more pain and friction. And obviously you don't want that in your knee because that hurts. For my sixth assessment, I did anterior cruciate ligament, which is your ACL, and knee injury prevention programs for soccer players. And this may seem like something really simple, but I wanted to know if these programs that are meant to help prevent ACL injuries were actually effective. And because there's a lot of stuff out there that is put out by U.S. Soccer and U.S. Youth Soccer and the national teams and all this stuff saying that they have these programs that can help prevent ACL injuries. And honestly, I was kind of iffy on whether or not that was really possible. And so I did a research assessment on it and found that because soccer is the most popular sport worldwide, obviously there's going to be a higher statistic of people who get injured and have knee injuries. And surprisingly enough, but not really that surprising, people who did do the ACL prevention programs, in fact, got injured less, which is good. That means that all this stuff is working. So if you just do the exercises, you won't get hurt. For my last assessment, I did the influence of quadriceps strength on ACL reconstruction surgeries. And this is a big thing because a lot of people think that once you injure something in your knee, it doesn't really affect anything else, but your body's an entire system. So once one thing goes out, everything else can kind of tumble out after that. I don't know if any of you have ever had to be in a boot. I know Katie has, but if you're ever in a boot or a cast, whenever you get it taken off, that muscle's really weak. And it might have been like you broke your wrist, but once you take it out, like your whole forearm, like the muscle there is just smaller if you look in comparison to your other arm. And so this kind of shows how everything works together. And specifically with this, your quad is right here on your leg, in case you didn't know. But it actually does a lot to help stabilize you. And whenever you tear your ACL, your quadricep actually has to do a lot to recover as well. Like you have to do a lot of strengthening to make sure that your ACL gets back to the way it needs to be. And a lot of people don't realize this, and it makes their recovery process a lot longer. For my interviews, so last year, I already knew that I was going to be doing this topic, so I kind of already knew who my mentor was going to be, and that is Joelle Murrow. She was my physical therapist whenever I hurt my ankle last year, and I had been in ISM last year telling her about me doing pediatric physical therapy, so she kind of knew a little bit about the program before. And so I had kind of been talking to her with Coach Goff's permission and kind of been throwing out the idea of maybe her being my mentor. And luckily she did agree to do it, and I'm so excited, so I really only had to do one interview. But for my mentorship with her, she works at Ben Hogan Sports Medicine, which is actually at the FC Dallas Stadium. If you ever drive by, it's on the corner closest to the actual club fields. What they do here, they're specifically for sports They're also the team physical therapists and team doctors for the FC Dallas team. And the types of patients they see, they obviously see the FC Dallas players. They see a lot of Frisco ISD athletes because the way the district is set up, a lot of us have team doctors who, for a lot of them, it's Dr. Walter who works for Texas Health, and it works as a chain. So these students get injured at the schools, they go to this team doctor. The team doctor, if they need physical therapy, will send them to one of the Texas Health physical therapy locations, which happens to be this one. Joelle. So what I do with Joelle is I get to go in and I get to observe as she works with her patients. Because I'm a student and I haven't gotten my degree in anything, I'm not technically allowed to touch patients or discuss patients or do anything really except watch what she's doing. And this is actually kind of nice because that's the best way that you can learn. And although I may not know as much as she does, obviously, but it's really interesting to see her working with these patients, see how she communicates with them, how she makes them laugh, she develops relationships with them. So what I do, I'm basically an intern. I kind of just do all the grunt work. I get to clean tables and set up exercises, but it's really fun. Actually, I really enjoy doing it because that's something that you have to do as a physical therapist. If I wasn't there, Joelle would have to do it, or the other PT, Kevin, would have to do it. So it's definitely something that I'm going to have to do anyways. And what I've noticed and learned from Joelle so far is a lot about the relationships that I was talking about before. Every time that she's with a new patient, she always asks them about something that happened last week, or she asks them about their weekend or what they're doing next weekend. She develops this personal relationship, so these people, whenever they get really down on themselves, she's able to bring them back up and not just like tell them, hey, your body's not working, you should fix that, do your exercises and stuff like that, because that doesn't motivate people. For my original work, my original idea, I had talked with Coach Goff a lot about this, and because I was so interested in ACL injuries, I was going to create this kind of survey and talk about how common ACL injuries were in not only female high school soccer players, but specifically in Frisco ISD. And once I had talked to Coach Goff about this idea and kind of seen if it would work, I went to Joelle and I kind of asked her about it. And she brought up a lot of issues that I didn't even think about. She's like, okay, well, how specific are you really going to be able to make that? Like, people can tear their ACLs how many different ways? Like, you can tear it anywhere too. Like, there's not a good way for you to do this. And so it was kind of discouraging because I got really excited about doing it. And so what we actually ended up doing is we just did a more broad spectrum of injuries in high school female soccer players. So we were trying to see what was more common. Was it an ankle injury, a knee injury, hip, back, whatever it was. So I created a survey and sent it out to all of the Frisco high school teams to see what exactly the most common injury was. And there were some issues that ended up arising with this, mainly because of the timeline of when it got sent out, because it got sent to these coaches, their school emails. It also got sent out right before winter break, so a lot of these people weren't checking their emails. So I had to get a little bit of an extension. And even then, like, we didn't get complete participation, but I did get enough to actually complete my project. So what I did, this is the form I sent out. And there's a couple questions on here. I asked what school they play for, just so I could kind of keep a record of who I was getting results from. I asked, are you on varsity or JV? Because there is a difference in the style of play and the level of play. This seemed like a very valuable question because you want to know if having the higher pace sport does any effect on any type of injury. I also asked if you played club soccer as well, because it's the same thing. Club soccer tends to be a little bit more competitive than school soccer is. The next thing I asked was, have you sustained one or more physical injury during soccer? If so, what is it? So this is where people just got to unload everything they've ever injured. And seriously, there are some people, I don't know how they're still standing with the amount of injuries they've had. But it was really interesting to see this too, because this is how I got a lot of my results. I got to see how many people had done what was the most common, and this is the main part of it. And then for my next part, I did the injury or injuries occur in school or club soccer? So this way I could find out whether the injury was actually happening at this higher level or if it was happening at a more relaxed level. And then I asked, where did it occur? Was it in a practice or a game? And this could have gone two different ways. You could assume that practice would have been more common because you're more relaxed, you're not paying attention as much, it's easier to injure yourself. Or you could have done in a game because it's more competitive. People, while they're thinking more about the game, they're thinking less about what their body is specifically doing. And then there was also others, so they could put in which injury happened at which. And then lastly, I asked, did this injury require special attention? If so, for how long? So this is where they entered, yes, I had to go to the physical therapist for 3 months, or I just saw the trainer every morning for about 2 weeks, or I just had a doctor's appointment, found out we were fine, or I just did nothing. This is some of the results that I got. This is how my setup was. You can see some of the schools that participated, varsity, JV, all this stuff. This was the chart that I used to create all of my visual representations because I know this isn't as pleasing to the eye. So I made these charts for everyone. So out of my results, I did a lot of calculations to see what was the most common. So for treatment, a lot of people ended up going to the physical therapist. That was the majority. And this was because, I'll get to this later, but because people went to the physical therapist more, I actually found this really satisfying, which sounds bad because people aren't supposed to get hurt, but for me, this means I'm gonna have a job one day. And the reason that I realized doctor and physical therapy were the same is because of, like I said before, they have the team doctor, they go to the doctor sends you the physical therapist. I'm gonna rip this microphone off. And so those kind of go hand in hand, which was definitely one of the issues that I realized after I had completed it. There you go. The next one that I did was game versus practice. And I thought it was really interesting because like I told you before, I didn't know if it was going to be a game or if it was going to be during practice. And I thought it was really interesting that it happened during game because every time I've ever seriously injured myself, it's been during a game. And I thought that was interesting just because from my personal experience and also because I wasn't really sure if it was going to be practice or not. For my next one, I did school versus club. And once again, my hypothesis was proven correctly because people did get injured more often during club soccer. And this is, like I said before, because club soccer tends to be more competitive, people play a little bit more rough, it's easier to get injured. Lastly, well, not lastly, second to last, the body parts that sustained injury. This was one of the things that I found really interesting because knees were the largest amount that got injured. And this was kind of interesting because I got to see, because based on my research, I kind of assumed that it might have been a knee injury. But after I had talked to my soccer coach about it, actually, she kind of put the idea in my head that it might have been your ankle just because people often sprain their ankles and that's a fairly common thing. But because knees ended up being so much higher than everything else, it was really kind of interesting to see that because I wasn't expecting it completely. And then I also wasn't expecting back to be on there. People injured their backs more than I expected. And it wasn't just like, oh, I strained a muscle in my back. It was like, I had to go to the doctor in physical therapy for my back. Like, people are scary. I'm guessing that's probably like goalkeepers that are diving around and everything, but that's crazy. Okay, this one was percent of injuries sustained per body part. So this is how many people injured each body part. And this one was, like I said before, where we expected it to be ankles. This is where that came in. So this chart basically tells you that 34.4 of the people who participated in my survey had injured their ankle. And then after that, it was knees, which was most common. So basically, ankles and knees are the most easily injured things. And this is really significant because of, like I talked about before with the anatomy of female soccer players, anatomy of females and then acting on soccer players. Because of our hips, our knees go in, and that affects everything below that. So if you hurt your knee because your Q angle, which is actually the angle from your hip to your knee, if that's really wide, then it's easier to hurt your knees. And whenever you hurt your knee, it's really easy to hurt your ankle because everything just gets thrown out of whack. But this was really interesting. I really enjoyed doing this original work because while it proved a lot of what I had assumed was already going to happen, it also showed me that you can't really assume anything because a lot of stuff that I hadn't gotten correct was proven wrong. So for my final product, I have a couple ideas. I thought about continuing my original work and maybe making it even more widespread, like trying to go into other districts and like expand the amount of people that I survey. I've also thought about completely ditching this idea and going along with something and seeing what Joelle has to say about what I should do. There's a lot of things that you can do with physical therapy just because there's so much equipment and there's so many exercises you can do, and the body's such a crazy thing that I really am excited to see where Joelle and I take this final product and what she has in store for me as I continue on through ISN. Thank you guys for listening.